Hi, I'm Dr. Rob Sheely, and I'd like to show you a little gadget that I use in my office with patients. This is called a MicroFET. It's a muscle testing device. We use this primarily with workers' comp patients and personal injury patients because it gives us the opportunity to measure muscle strength or weakness from one side to the other. It's very cool. Let me show you how this works. This is the device test. And you'll see up here in the force right here, I'll push down on this and you'll see the pressure go up on this. And what it does, it measures the highest test, and we do this test 5 different times, and then it gets put into a report software. Let me show you how that works. This is checking a biceps muscle here. But when we go in and do the testing, there's all kinds of different protocols. This is a test that was used to check flexion, extension, and right and left lateral flexion. This is a person that was in an automobile accident, and we wanted to check to see if there was any hidden weaknesses in the musculature to determine what kind of progress and what kind of treatment plan we'd make. So let's show you here what we would actually do when we do a report. It shows extension, lateral flexion, anterolateral flexion, left and right. This shows the actual data, the raw data from each one of these tests. And you can see the comparison right and left. It actually shows validity rating. So if the test result isn't clear enough, it can show an invalid testing, and then you do it over. This system can actually determine whether a person is malingering, whether they're trying to make up their pain. I actually do have patients come in here and think they can fool me and indicate that they're in pain when they're not. So when we do this test or any orthopedic neurological testing, we tell them there's some tests that are going to be positive, some negative, some supposed to cause pain, and some are not. I'm not going to tell you which one, so I need you to be extremely accurate. I will report exactly what this is. And I've had very few trouble with anybody trying to make up pain. That's ridiculous. I don't have time for people that want to do that. But here's what's really cool with this. This shows a blow up of this extension testing. Now, if you look at the red line here, it looks kind of out of sync with the rest of them. And if you didn't know, this is the first test that was done. So the patient really didn't know what was going on and how to do the testing. But you can see the rest of them, the 2 through 5, they fall within line. So this is actually a valid test. That's why you do it 5 times. So this shows that it's a good test. The strength is good in this. And it's really valuable for personal injury and workers' comp because it's an objective finding. It's very difficult to challenge this. The device is all calibrated. When you see this kind of information in a report, especially in a personal injury case, these are the kind of things that keep the case from going to a trial, because this is then presented in front of a jury, and if there's clearly a weakness, maybe one side compared to the other, where a person has a permanent shoulder injury where there's weakness there, and this will prove that, they would just as soon settle, oftentimes, than go to a jury. I found this again and again with really good documentation. The case tends to settle. Very few of them go to trial. But at any rate, I've done a lot of them over the years, and I found the more detailed that you get with these kinds of tests, it's just very good for the patient and for the case and for everybody involved. So I'm very excited about this. Some of the coolest stuff, don't you think? I've ever seen. This blows up the rest of those. And I just thought it was cool enough to share. So I'll talk to you soon.